Welcome to this week's video blog. I thought I'd talk about back pain, lower back pain, possibly middle back pain for some people that are having it, especially if you sit down a lot, which most people do nowadays for their job. They drive a lot, their commutes are long, they're sitting in the desk all day. So one thing you can do from a seated position, a lot of stuff we show is on our feet, but just to show you something that you could do in your own office, cubicle, if you're in front of people, it shouldn't be too awkward, is you want to do a quick test. Is you want to rotate your body to the right so everything's lined up from your head all the way down to your spine, and then you want to rotate left, and you want to see which side has a difference. So if you do this and you start neutral and you go to the left and it just doesn't quite go, but the right is really good, what we're finding and what I'm using now at our clinic is total motion release. We've taken all 3 levels of that class, and it's really good stuff where you train the opposite side, the good side, to help the bad. So my left was really gunked up. My right, I'm going to go for 2 sets of 20 seconds each. So I'm going to rotate as far as I can, really contracting all these muscles through the trunk. You'll feel it in your hips a little bit, even into the shoulders. And then you want to do that 20 seconds, come back to neutral, and then repeat for another 20 seconds. And then right after, you want to retest. Most of the time, I'm going to say it's close to 90% of the people that I see, by doing that, it takes about 1 minute, that will start to increase motion and decrease some of the stiffness and pain that you're having in your low back. So it's just a simple seated twist. It could also be done standing. So if you sat for a while, you want to just stand up and do that, and it may be different. Sometimes when people stand, the side that was tighter sitting is the opposite when they're standing. So you always want to do the good side to help the bad side, or the side that's not painful help the help the painful side. Once again, if there's any questions, call, email, stop by. Hopefully that helps. That tip of the week. Thank you.